Welcome to the Organic Instinct Health and Wellness podcast, where we dive deep into the insights of living a healthier, more vibrant life. I'm Daria Kuchikali, your guide on this journey towards a holistic health and well-being. Here at Organic Instinct, we believe in the power of nature, the wisdom of ancient practices, and the advancements of modern science to create a balanced, nourishing lifestyle. Today, we have the pleasure of hosting Esra Baser, an experienced osteopath with 7 years of expertise. Specialising in women's health and well-being, Esra's practice focuses on several crucial areas, including pelvic health, preconception care, pregnancy, birth preparation, postpartum recovery, and the management of endometriosis and pelvic pain. In today's episode, we will delve into the significant role of osteopathy in women's health. We will discuss how it can help manage menstrual discomfort, alleviate pregnancy-related issues, support postpartum recovery, and address pelvic floor dysfunction. Join us for an insightful conversation with Esra Baser as we explore these essential topics. Welcome, Esra, to the show.
Thank you, Daniela. Thank you for having me on.
First question, Esra, and I think the question that everyone probably wants to know is, there are so many modalities out there. You've got chiropractors, physios, myotherapists, and you've got osteopaths.
Yeah.
What is osteopathy and what type of treatments do you offer your clients?
Yeah, so osteopathy basically focuses on the neuromusculoskeletal system. So this is the main part of it. It includes nerves, bones, muscles, and joints. Now, it's important that we focus on our main principles. So the main principle being the fact that the body is a unit. So systems and structure is related, and we make sure that we look at the body as a whole. So if you have a symptom in one area, we don't just focus on that area, we look at everything else that's connected to that area. So this is basically treating the system as a whole.
Yes, I love that holistic approach. So it's not just manage the symptom in that area. It's a more of where is that referred pain coming from and working out mechanically rather than just focusing on one single area. I love that. Now, I understand that you and some members of your team are really well versed in women's health osteopathy, and from personal experience myself of seeing you and your team and benefiting immensely from it. I think what a lot of women want to know with regards to physio osteopathy and how you can assist women is the pelvic floor and the pelvic floor function.
Yeah.
Can you break it down for us? What exactly is the pelvic floor in simple, clear terms? And how is pelvic floor so important, and why is it so important with women's health and well-being?
Yeah. So it's very important, obviously, to understand the pelvic floor before we continue on. So pelvic floor basically is a hammock. So think of the it's a sling-like muscle. So it starts from the pubic bone, so from the front of the pelvic area, and it slings to the back, to the tailbone area. So basically, it's a sling of muscles, and just like a hammock. If we don't understand the pelvic floor, we won't then understand how we can have consequences later on with that as well. So let's do a little basic exercise and think of the pelvic floor in that area. So exactly what I just explained.
Yes.
And then let's think that we've got a blueberry in the center, and we want to stop ourselves from urinating, or we want to lift that pelvic floor, that blueberry up. So let's try do that now for all our listeners.
Okay.
Let's try lift that blueberry up.
Visualizing now,
yes,
the blueberries right there in that hammock and lifting. I can, I can feel that.
And we want to make sure that we're also letting it go.
Right.
So can we feel the blueberry lifting, and can we feel the blueberry letting go? You can also imagine it as an elevator. So we've closed the blueberry up, or the person up in the elevator.
Yeah.
We've gone up to level 3, and then we're dropping down to base level and opening the door. Now, it's important to make sure, though, that you're not using your glutes and you're not using your legs or your abdominal muscles. So if you are squeezing any of those muscles at the moment, you are doing that incorrectly as well.
Wow.
So this is a good way to kind of know, okay, where is the pelvic floor? Am I able to lift it up? Am I able to let it go? If I can lift it up and let it go, that's pretty good. And we've got no symptoms, great. If we can't do that right now, then we know already before we continue on that there is something wrong in that pelvic floor.
Right.
So it's a nice little tester.
Okay, so what are the main consequences that arise when the pelvic floor isn't functioning well? I mean, particularly focusing on issues such as incontinence, prolapse, painful intercourse, especially after childbirth.
Yeah. So obviously, if that pelvic floor is not functioning optimally, then we will get these concerns. Now, they're only some of the main ones. There is obviously a lot more, but I would say they're probably the main concerns that we would experience. So some of the things that we would experience, like you just said, incontinence. Incontinence, it's the fact that it's that involuntary release of that urine or feces. So these are the concerns that we may see in our community,
Right.
with our women as well. I would go through the basics. Let's go through the basics and go, okay, there's two types. I'm not going to go too much into detail, but we'll go enough to understand if we have that concern at the moment.
Sounds good.
So stress urinary incontinence. Basically, this is if you are coughing, if you are jumping, if you are running and you need to close your legs, otherwise
Red
you're
flag.
red flag. Yeah, that's stress urinary incontinence. Now, if you're having urge urinary incontinence, this is if you are, let's say you need to go to the bathroom, but you're not making it to the bathroom.
Right.
And just at the door, you're opening the keys in, or the house, you've parked your car, you've entered, and we've had an accident.
Right.
We're trying to hold the legs together, but it's not helping. That is urge urinary incontinence. So if you're experiencing that, that is also something that we need to be treated for and addressed.
And that's something you can do with Women's Health Osteo.
Yeah, definitely.
Incredible.
So we would do an assessment, and according to that, we would create treatment and a management program as well.
You know what's, I think, concerning, Esra, is that a lot of women think this is normal and that they have to live with this their entire life. And sadly, incontinence isn't something that's only for the elderly. You've got a lot of women who postpartum their first child are experiencing incontinence and sometimes not seeking help, or they may address this with their GP, who may send them to some modality that may not suit the concern that they need addressing. So I can see how this can slide under the radar for many women, and they think it's normal and just live with it for years. And it's really important, the work that you're doing in this field with regards to women's health and continence. So what about the other issues like the prolapse, which I think is a big issue with women, again, undetected?
Yeah. So prolapse at the moment, the studies are showing it's actually 1 in 2 women experience this in their lifetime. So it's not just after childbirth. A lot of people think it's after that vaginal delivery, but it's after. It could be childbirth. It could be incontinence. It could be due to constipation. It could be due to heavy lifting.
Right.
So prolapse can happen for many reasons. But it's important to obviously address that too. What a prolapse is the fact that, again, we're talking about this pelvic floor, and we've got the 3 main organs. So we've got our bladder, we've got the uterus, and we've got the rectum, the bowels. So basically that sling that we're talking about is holding these organs up. Now, what happens is, the consequences of childbirth or constipation or heavy lifting, all these organs are held by strong ligaments.
Right.
Now, if these ligaments, with time and with what we've just explained, if they're stretched and pulled, these organs can slowly start to lower and drop in more lay terms, I guess. Yeah, there's a lot more to it, but let's say in lay terms, it will drop. So if that drops, that is the movement of those organs. So it's important that we're addressing, firstly, do we have a prolapse? Do we have movement? Are we experiencing the symptoms of prolapse? So we should get to that now. What is the symptoms of prolapse? Are you feeling dragging? Are you feeling heaviness? Are you feeling like you've got a tennis ball? Are you not completely emptying your bowels, and your urine? Like, are you finding that you're kind of going to the bathroom and you've got a few dribbles, but you know that you haven't completely emptied? And then as a result, are you getting frequent UTIs? because that's what we're seeing a lot of, why am I getting UTIs all the time? I also can't go to the bathroom properly. I'm not emptying properly.
Wow.
Well, is there change in the actual organs? Is there movement in the organs? And we don't want to really say that, they're dropping, they're not falling out.
Yeah.
But it's just the fact that there's weakness in that
Yes.
area and they've lowered. The good news is you can do something for it.
Excellent.
And it's important that we address that. It's important that we don't let this leading on for years and years to come, because then it gets to the point where we can't do too much about it and then we need surgery.
Yes, true.
So that's important as well. So that's more with the prolapse.
Yes.
Yeah.
You then get a lot of women who, even pre-pregnancy or postpartum complaining of painful sex.
Yep.
What are the causes of that?
Yeah.
And how can you assist patients with these concerns?
Yeah. So when it comes to painful intercourse, there's two parts to it. So there's ones that I see that have got vaginismus. So that's more linked to the fact that there's tightness and it's more that involuntary tightness of the vagina.
Right.
But then we've also got, obviously, like you said, after birth. Now, pregnancy, estrogen levels have gone high up.
Yes.
Right? So estrogen is very high. We've plummeted. Even in that vagina area, it's moist, it's plump. There's a lot of blood flow in that area. Now, we give birth and that completely drops. So when that drops, there's a lot of consequences in terms of everything else as well, in terms of how they feel, but also in terms of the vagina, it's more dry, it's more thin. And these consequences obviously are going to then lead to painful intercourse as well.
Yes.
Pelvic floor not functioning appropriately, that's also going to be another aspect of it. But it's amazing how the system works, because it's also letting you know that you're not ready to have another baby at the moment. But you also need to address.
Of course.
Yeah.
I would love to know how you address such an issue.
Yeah. So the main advice that we give, the biggest advice, the first couple of weeks, because we can't touch the pelvic floor region the first couple of weeks or up until 6 weeks. The first and best advice that I can give is horizontal rest.
Oh.
Actually laying down as much as you can in the first couple of weeks and resting.
Okay, ladies, how many of us are actually doing that? I'll just put my hand up and say it wasn't me, because I'm the kind of girl who I give birth and I go shopping the following week, or I get straight into the vacuuming.
Yeah.
And I don't think we do justice, which if you look at certain cultures, they honour the postpartum period. They give you a 30-day rest or a 40-day rest. And this is cultural wisdom, which I believe in the West we have lost. We expect the woman to bounce back after giving birth, hence compromising her pelvic region and potentially leading to things like prolapse and painful sexual intercourse afterwards. So it's really important that these issues are not taboo. They need to be addressed, and they need to be addressed with the right health professionals.
Yeah. And it's so simple. And that's the first question that everyone asks. What do I do? And I'm like, it's so simple. First, just rest.
Yes.
And even if it means that every time, 10 minutes of the day, you're just laying down horizontal, it doesn't matter. Even that 10 minutes, the first couple of weeks will make a difference. So I'm not saying you have to rest the whole time, because everyone's going to say, how? Like, we're busy, we're doing a lot. 10 minutes of horizontal rest is actually enough.
Wow. Okay.
And it's okay.
Did you hear that, ladies?
Yeah.
Give yourself 10 minutes.
And it's not sitting down. So a lot of the time we sit, we get our tea and we're like, all right, that's rest. It's still working. It's still activating. We're still trying to keep our body in this position. So we actually want to lay and relax, and obviously there are certain movements that I do give my patients in the first couple of weeks. So to make sure that they're still getting that movement, their posture, breastfeeding or bottle feeding, whatever, the way they're doing that, what they're using, are they using pillows? All of this plays a role as well. But from 6 weeks on, then we can take over. Then we can do the pelvic assessment. Then we can do programming.
Yes.
That's when that kicks in. But at the start, it's more rest.
Sure. Interesting that moving into sort of the pregnancy and the postpartum journey, even my own experience with Esra and her team, in my last trimester, you'll remember really well, Esra, that I struggled to walk due to my pelvic girdle issue that I was experiencing. And there was one occasion where for the day I had to spend my day on crutches due to the immense pain and pressure in that area. And I thought, who can I possibly go to address this situation? And, lo and behold, Esra and her team. And I saw Esra consecutively, week after week.
Yeah.
And I would walk in almost feeling, like an old woman walking to the clinic, and I would walk out really healthy and vital with immense mobility. So it's amazing what a few, strategies and different muscular areas that she pressed on was able to assist me to get through those 3 months. And then even in my postpartum period, Esra, with your team, and I remember specifically Anita, we did about a 6-week course of regaining my pelvic strength, correcting my diastasis recti, which is that abdominal separation that a lot of women have. But again, they don't correct it. They believe that pot belly that happens after you give birth is normal and they just leave it to time. But sometimes these things need a little bit of work, don't they? They need potentially reformer Pilates, or I'll leave it to you to explain. So during that pelvic girdle that women are experiencing and that postpartum prolapses and the abdominal separation, how does your team help women recover and get through that period, Esra?
Yeah. So we can help right from the start, because you can get pelvic girdle pain right from the start as well. Some people do experience it from second trimester.
Wow.
So it's not always third trimester. Most women do due to the congestion and the hormones in that area. But a lot of women do experience it in the second trimester as well. So even taking a step forward and coming trimester 1, the nausea, the headaches.
Yes.
We help treat the symptoms of that. We can't get rid of the nausea. We do recommend other modalities like Chinese medicine for that as well. But we help with any dysfunctions that are pre-existing. Now, if we can work on the dysfunctions that are pre-existing, that is most likely going to avoid the pelvic girdle pain most times from kicking in intensely.
Right.
But what happens is everyone comes in once it's already kicked in.
Yes. Human nature, isn't it?
Exactly. But coming in, first trimester is actually a lot more beneficial because we can avoid it. Now, once we get into second trimester, it's the structural changes. So during this time, we get more of the structural changes. Because of the structural changes, the body's going through that biomechanical forces and the changes in the body. That's what leads to pelvic girdle pain. Now, that can be from the front. It's an umbrella term. So it can be from the front, it can be the pubic pain, or it can be from the back or the hips. So it's not just kind of one area. I would say everyone experiences it different depending on what's happening in their body. So how we can guide you, we will treat you. So we will treat whatever dysfunction we find in the body, and then we'll create a program for you. So we'll create a rehab program according to what is needed. Everyone's different. So we don't give kind of one set of exercises for all our patients. It's going to depend back to our principle of the body is a unit. The body is a whole. Your body and my body is different. The way your body responds to someone else's body is going to be different. So we will give it according to the examination that we've done.
So it's a very tailored approach to the individual patient.
Yeah. So here at Organic Instinct, upstairs, we've got the clinical Pilates. So we can use the reformer upstairs. At Gladstone Park, we've got upstairs Bodyflex. So we can also use the gym upstairs as well, or we can also do it in our rooms too.
Yeah. And even from experience, 3.5 years postpartum, and you still feel like you need that abdominal work to assist with your lower back pain management. And, a strong core is a strong body essentially. And hence why I even embarked on a 10-week journey with Esra's team to help strengthen my core. And I believe that from week 1 to week 10, I saw a tremendous difference with the team using the reformer Pilates equipment up there. So it's not just about pregnancy or postpartum period. Esra and her team are able to cover a whole host of different areas of a woman's life. And it's not only restricted to women, that the whole team looks after from pediatrics all the way through to the elderly in a very holistic manner, which is absolutely fabulous. Yeah, from first-hand experience.
And also birth prep. So working from 36 weeks onwards, we do focus on birth prep as well. So a few of us do internal preparation. So we do work with the pelvic floor internally. We release tension in that area. We make sure that the pelvic floor is functioning appropriately to help with birth. Because if the pelvic floor can lift up and let go, it's going to be able to birth the baby better as well.
Definitely.
And then according to research, a better and stronger pelvic floor actually makes second stage shorter.
Oh, wow. There you go.
Yeah, it can help. It can assist with that. Sure. Obviously, there's other factors as well.
Yes.
But one of the factors is having a strong pelvic floor to reduce that time frame.
Yes.
Because it just makes it easier for the baby to descend.
I can speak from experience with number 4 on that one.
Yeah.
She came very quickly.
Yeah,
and I was seeing you for the entire 3 months, which was a huge benefit to my body and even my mental health, because you can imagine, ladies and gents, if you're watching, because I'm sure you've got a loved one in your life who's either a mother or a sister or daughter or a niece, and the mental toll that it can take on you when you're physically incapable of doing your everyday tasks is huge.
Yeah.
So it's really important that we seek professional help and not ignore it and pretend that it's a symptom of life, it's a symptom of pregnancy. We just need to, live with it until we give birth, or live with it for the rest of our life because we're destined for this. Which brings me to the 6-week postpartum period, Esra.
Yeah.
I don't think there's enough attention in this area. I don't think that enough women know that there is such a thing as seeking some professional help 6 weeks postpartum, about, looking for the signs of prolapse, for instance, or incontinence.
Yeah.
What is it that your team and yourself do or help women in that 6-week period that can help change the rest of their life in terms of their overall health and wellness?
So it's so right. Like even with the 6-week time frame, I feel, and with the 7 years that I've been treating, patients will go to their health professional, and after 6 weeks, they're told that everything's fine.
Mm-hmm.
Basically, they're told, you can go back to doing what you were doing. You can go back to having intercourse. You can go back to everything that you were doing. You're all fine. There's nothing there. And then they also would ask, let's say, what type of preconception they want to take, and then that would be it. It would end it at that point there. What we do, though, is we take it from 6 weeks. So we can only do internal assessment after 6 weeks because the pelvic floor needs to heal. We need to allow that area to heal.
Yes.
It's got its own self-healing mechanism. It's got its own way of doing it. We need to let it heal first. Then we take over and go, okay, where is it at? So we look at, is there a prolapse? So we can assess that.
Sure.
We do all the questioning. So we look at, is there any bowel issues? Is there bladder issues? Is there prolapse symptoms? Again, is there incontinence? All of that. Intercourse. We kind of look at everything as a whole and then take it from there. We also look at the body as a whole in the sense where the abdominal region, so the diaphragm is the breathing, it's very important. We need to make sure that the diaphragm is functioning appropriately. Now, the body is amazing in the sense where the diaphragm and the pelvic floor, they actually are connected and they work synchronizely. Now, after pregnancy, because of the pressure that's going through here, that intra-abdominal pressures change, these two guys can't work together. So we assess everything in this area and we make sure that we can get it back to functioning appropriately again, to the best form.
Of course.
We want to make sure that we're getting that mum back to their best form.
Yes.
It might not be their old self, but their best form now. So we assess the breathing, we assess the pelvic floor, we assess the pelvis, we assess the back, we assess everything in that area, and even general pain. So like their breastfeeding posture, their neck, their headaches.
Yes.
Obviously, a lot of the time they come and they say they've just got tightness, their shoulders, they've just got that heaviness in their shoulders.
Definitely.
So we assess everything and we create a program. So treatment, hands-on. We might do, and this is in general with osteo in general, we'll do soft tissue, whether they need dry needling, whether they need fire cupping, whether they need a clinical program, whether they want to go back to the gym. If they want to go back to the gym, we create a program to get them back there. If they want to get back to running, there's a protocol. There's certain things that they need to be able to tick off before they get back to that. So, for example, with running, can they do single leg hops, 20 of them without having any incontinence or pain? Can they do a squat? Can they do a squat and have no pain? Can they bend over and have no pain? If there's pain in these regions, then we need to take that step back, treat, then create the program for them. And generally we ask them to give us that good 6 to 8 weeks to sometimes 12 weeks. Everyone's programming is very different.
Yes.
And I always say it takes 9 months to grow this baby. Let's not expect to get back to ourselves in 6 to 8 weeks.
Yes.
Let's give ourselves that time. Give those organs the time to settle back. Give the body the time to settle back internally as well, not just externally.
I think there's a social pressure, Esra, when
Yeah.
you see popular celebrities bouncing back after a week with a very flat stomach with their baby in a stroller, and a lot of women fall into the trap of aspiring to be like that.
Yeah.
So they put this extra added burden and pressure on them that society often places on you. It's almost an embarrassment. Are you still lying down? You gave birth 2 weeks ago. Type of stigma and stereotype, which is completely wrong. And again, very much, in the Western world, we are expected to bounce back, as I said earlier. Whereas in traditional customs, like in Eastern customs, and even in the Middle East, you are encouraged to lie down and honour the postpartum period. What I love about everything you've just mentioned is that it sounds like the programs that you offer women with regards to their women's health, whether it's pregnancy or postpartum, they're very comprehensive. You're really looking at an individualised program based on symptoms, based on age, based on their experiences. And I think that that's invaluable, and we don't have enough of that in our society. And I think, not enough women know that this exists. So it's fabulous that you've enlightened us on this episode today about all of these really important functions and features. And I, for one, a mother of 4 children, did not know much about this with the first 2 children that I had. I honestly thought that's it. You bounce back and you just get back to work. Whereas I honoured my body and my postpartum period with number 3 and 4. And I sought the relevant help with yourself and your team. And I noticed immense benefits. Even now moving forward with my continence, with all sorts of things that we discussed, I feel like I'm in a lot better shape, in a lot better place than most other women who are potentially in their 40s at the moment. So I thank you for popping out today with your time and enlightening our audience with some really, really important messaging that you've given today. If you want to catch Esra and her team at the Hume Osteopathic Clinic, you can do so at 2 of their venues. They are in Gladstone Park and they're also in Coolaroo at the Organic Instinct premises. Esra Baser, we thank you today for your time.
Thank you.
We hope to speak again soon.
Thank you so much.